Hi, my name is Angela Northcutt, and I'm a Doctor of Physical Therapy student at the University of Kentucky. This presentation explains opioid addiction, why opioids should not be used to treat musculoskeletal pain, and why physical therapy is the best choice for treating musculoskeletal pain. First of all, addiction attacks our normal reward system, which includes the following areas: the medial forebrain bundle, the nucleus accumbens, the ventral tegmental area, and the medial prefrontal cortex, which can all be seen on the picture on the right. When opioids are introduced into the system, it increases the amount of dopamine projected to the ventral tegmental area to the nucleus accumbens, and this stimulates a state of euphoria. The nucleus accumbens projections can go to memory areas in the brain. Also, the body naturally inhibits GABA, which is a neurotransmitter that is responsible for wakefulness. And it is inhibited when the levels of dopamine increase in the body. The overload of dopamine that stimulates this state takes place for an extended period of time while opioids are in the body. Individuals who suffer from depression, anxiety, personality disorders, psychological stress, all have an increased risk of developing an addiction to opioids. Individuals are more likely to repeat use due to a combination of reducing pain and creating feelings of pleasure. Over time, a compulsion to use opioids occurs and moves to a repeated use, to tolerance, and dependence to opioids. Individuals have trouble refraining from opioid use because of the effects of withdrawal. Over time, the brain adapts to the increased dopamine, which causes the brain to function more normally when using the opioids versus when not using them. And then after multiple usages, a higher dosage is required to get the same pleasurable and pain-reducing effect. To understand opioid withdrawal, let me explain an area of the brain which causes the symptoms related to opioid withdrawal. The locus coeruleus produces a neurotransmitter called noradrenaline, which is responsible for wakefulness. When opioid use first begins, the opioids suppress the release of noradrenaline, which results in drowsiness, slow respiration, and low blood pressure. However, the locus coeruleus adapts over time to opioids and releases more noradrenaline to compensate, so the individual feels less of the effects of drugs while maintaining wakefulness and increased respiration and a normal blood pressure. Also, when opioids are not in the system, the body continues to release these increased amounts of noradrenaline, which causes the side effects of withdrawal, which include jitters, anxiety, muscle cramps, diarrhea. So you may be wondering why opioids are so bad for treating musculoskeletal pain. Well, first of all, evidence does not support the use of opioids for long periods of time, and opioids used for new or acute pain can lead to addictions and overdose. As previously stated, with tolerance, increased dosages are required to get that same pain-relieving effect, and higher dosages are known to cause death due to overdose. Repetitive and chronic usage of opioids leads to addiction and endocrine dysfunctions affecting different hormones such as testosterone and estradiol. Opioids also increase the likelihood of disability. Receiving more than a week's supply of opioids or receiving 2 or more opioid prescriptions soon after an injury doubles the risk of disability 1 year after the injury compared to workers who didn't receive opioids after an injury. Individuals with other mental conditions and addictions are more likely to receive opioids, which may further contribute to their disability. Opioid, opioid users that require higher dosages for pain relief overall have a lower quality of life and experience delays returning to work than individuals not prescribed opioids for musculoskeletal pain. Exercise results in decreased pain, return to work sooner, shorter leaves from work due to sickness than passive interventions. Those who receive physical therapy have a 20 to 30% reduction in pain, and physical therapy is shown to decrease medical costs for people with low back pain. Despite clinical practice guidelines showing evidence that low back pain should be treated with NSAIDs and non-pharmacological therapy, pharmacological agents still continue to be overused and overprescribed. Physical therapy used earlier in care for patients with low back pain may reduce healthcare costs. Patients who saw a physical therapist first have been shown to have lower opioid prescription rates, advanced imaging such as X-ray, MRI, and CT, and lower emergency room visits. The CDC and the American College of Physicians advocate for non-pharmacological pain management for chronic pain, which includes musculoskeletal pain. Early physical therapy use decreases the total opioid exposure, a 10% reduction in the probability of any opioid use for patients with shoulder, neck, knee, and low back pain. Physical therapy can provide mild to moderate protection against risk and intensity of long-term opioid use for patients with severe musculoskeletal pain. Receiving physical therapy within 30 days of injury enhances protection against opioid use. So patients with moderate to severe chronic low back pain or hip or knee osteoarthritis pain have shown that opioids are not superior for treatment. The CDC recommends PT over opioids for chronic pain treatment. Direct access to physical therapy has been shown to reduce medical costs, time off work, number of episodes of care, and episodes of reoccurrence. Physical therapists possess advanced knowledge and strategies in prevention and health promotion. And lifestyle changes and increased physical therapy can lead to health benefits in those with chronic disease and lead to an increased quality of life. The ultimate goal of physical therapy in prevention is to reduce the need for more dangerous health interventions like opioid medication and surgery. And that is all. Thank you.